Now, what other supplements did you incorporate for bone health? This is going to get
So
interesting.
I added boron. I added 2 milligrams twice a day.
Excellent.
I added calcium, magnesium. Like a lot of people, for years I took calcium, magnesium, and then these studies started coming out saying that if you take calcium, it's going to increase your risk for calcified plaque in your arteries and it's bad for heart. The reason why they were doing studies on calcium and cardiovascular conditions is because prior studies had shown that calcium reduces hypertension, that calcium is good for the heart, and all of a sudden calcium's bad because the problem why you get plaque in your arteries is because of calcium. And I think this was just completely wrong from the beginning.
Without question. Now, when you say calcium, magnesium, what's the ratio between calcium and magnesium?
Okay, so I usually take 1-to-1, but that's partially because I tend towards constipation and magnesium is a stool loosener. But for a lot of the patients with osteoporosis, I recommend 2-to-1.
Let's get a little more granular. Which form of calcium, which form of magnesium do you prefer?
Yeah, so I don't like calcium carbonate because that's the least absorbable form. I grew up on the idea of hydroxyapatite, but I don't really think there's enough data to show that that's really the most beneficial form. So I think there's a number of absorbable forms. I think citrate, malate, several other forms like that I think are easy for the body to absorb. Possibly using several different forms is good. So I use a citrate malate combination.
Okay,
and
great.
And then I also used something that's kind of controversial, which is strontium citrate.
Boost.
Yes.